Welcome back now. Are you afraid of the dentist? Do you put off going for fillings and root canals until it's too late? Well, now one Dublin clinic is offering nervous patients the option of sedation with the drug temazepam to keep those nerves at bay. A trip to the dentist for Gabby Kelly in the past usually involved the mother of two hyperventilating in the chair due to lack of control and fear of pain.
I had a couple of bad experiences about 4 years ago, and again where there was a lack of control, and even though I was getting injections I still was feeling a lot, and it's the sound and the sensation.
You said in the past you prefer to give birth again than go to the dentist, is that right?
That is right, and I had 2 cesareans, but yeah, no, I would.
Was it really that bad for you? I mean, I know people say, oh, I hate going to the dentist, but
no,
I mean, for you, was it?
It was... I wouldn't sleep the night before and I'd be worried about it. Now I'd have to go. I used to leave it until it was absolutely necessary, and at that stage I'd probably be in so much pain with an abscess or a filling that really needed to be done that I would just have to go, and that was it.
Gabby Kelly, how are you, Gabby? How are you doing today? Good.
But now Gabby is one of a growing number of people undergoing dental sedation. Here at the Seapoint Clinic in Blackrock, County Dublin, they offer an oral sedative called temazepam, which helps nervous patients relax.
Today we're going to be doing just 2 fillings today down on the lower right hand side. We are going to give Gabby a little bit of an oral relaxant just to make her feel a little bit better. She's been great though throughout the whole procedure. She's from day one came in, was quite a nervous patient, I suppose you could say. I suppose just by sitting in the chair was even nerve-wracking for you, the whole setting itself. So today, it's a massive feat for Gabby to actually be sitting here undergoing treatment and feeling good about it, I think.
Yeah. Do you have to sedate many of your patients? I mean, is it that common?
It is very common. I mean, the main thing to know is that you're not alone. It is very widespread out there. I'd say even 1 in 3 or 4 would suffer from a dental phobia. It's just really about overcoming it and becoming used to the setting, and there are lots of ways and means, and it's really just by finding that technique that works for the patient.
Gabby was saying it's like drinking a bottle of wine.
Yeah, you do feel a little bit oozy and queasy after it, but it's a good feeling that you might have a little bit of a doze and sleep in the chair. It's not something you're going to be really alert for. You just feel at ease, and you feel a little bit happier. I don't think any fears really overcome the situation at all.
Yeah.
I mean, not for Gabby. Very good.
It's good for someone like Gabby who's a nervous patient, but probably sedation would be good for somebody who's Parkinson's disease or cerebral palsy, who might be jerky in a chair, or people with very sensitive teeth even.
Absolutely. I mean, for people who need to go through long treatments, and they want to just get it done instead of having to come back and forth. People with muscular disorders, it is something which patients themselves would feel it's hard to stay still possibly in the chair, and this will help to relax them. Now Gabby, unfortunately it's not as good as wine, but you will feel nice and relaxed after it. Okay, you feel okay? Perfect.
The sedative usually takes about 15 minutes to work its magic, and then Gabby is ready for action.
Okay Gabby, how are you feeling?
Great.
Great, that's a good sign. You're saying great now.
And it seems that once a frightening needle has lost its edge.
Topically numb that gum so that you don't feel the anaesthetic as much. So nice and wide for me.
And as for drilling, well, that's not a problem either. I'm asking for that next time I'm at the dentist.
I'd be one of those who'd be very nervous about going to the dentist.
Have you ever had have you been sedated before?
Sedated?
Apart from...
Lump hammer. Probably the best thing. I had to be knocked out once.
Did you?
Yeah, had to knock me out once. Just yeah.
So you have been?
I have been all right, yeah.
Did you drink it or inject it?
Oh, no. I mean, like, as in gas and knocked out and completely out.
Yeah.
Anyway, it worked then. Anyway,